I'm going to hand over to Francis and his colleague Tiwonge Mtande, who will join us in the panel discussion. Thank you.
Good morning, ladies and gentlemen. This morning, I'm going to present findings of a WHO study on experiences of REC members and administrators in Malawi in reviewing research protocols during the COVID-19 pandemic. In this presentation, brief background to the study. I'll explain the study objectives, methodology, and then I'll highlight the key findings from the study, and finally I'll make recommendations to conclude. As a background to the study, COVID-19 has ravaged many nations on the global level, causing health systems to adjust and to develop measures to contain the pandemic. Research ethics committees in Malawi have not been spared by the pandemic, and as a response, Malawian REC developed research guidelines to guide researchers during the pandemic. However, we do not have any national guidance on how RECs should operate during pandemics. Therefore, we decided to conduct this study in order to learn lived experiences of REC members who review research protocols during the pandemic. The aim of this study was to understand the experiences of Malawian REC members during the COVID-19 pandemic. Specifically, we wanted to explore Research Ethics Committee members' experiences in reviewing research protocols during the COVID-19 pandemic, and we also wanted to identify common ethical concerns raised by our REC members. This was a cross-sectional descriptive study using qualitative research methods. We recruited our participants from one national research ethics committee and two institutional research ethics committees. Our participants were research ethics committee members and REC administrators, and these participated in in-depth interviews. A total of 15 participants were recruited for this study. These 15 participants comprised 12 REC members and 3 REC administrators. Thematic analysis was used to analyze the data. Now I'm going to talk about key findings of the study. The findings have been categorized into 2. The first category is about experiences regarding REC operations during the COVID-19 pandemic. And the second category is about ethical issues raised during protocol review meetings. Now, COVID-19, the first key finding about the experiences regarding REC operations during the COVID-19 pandemic was the slow development of guidance documents and SOPs for REC reviews. You may wish to know that we conducted this study 11 months since the first case of COVID-19 was confirmed in Malawi. But at the time we conducted this study, there was no national guidance document to guide REC operations in the country. And as I'm speaking, we do not have any national guidance document to guide REC operations in the country. Of course, RECs are also yet to develop new or to review their SOPs to guide their operations during the COVID-19 pandemic. The second key finding was about the silos between RECs in Malawi. Among the 3 RECs that were involved in this study, we found out that each of the selected RECs had developed guidelines for its researchers based on what they considered important. These guidelines were, however, different from one REC to the other. For instance, one REC provided a recommendation to raise financial compensation for research participants, while others remained silent on the issue. Respondents of our interviews whose guidelines did not include the issue of participants' compensation felt that, if they were to revise their guidelines, they would include guidance for participants' compensation, because it was raising a lot of debate during protocol review meetings. And this was because the prices of goods and services had increased since the pandemic hit the country. And again, there was no evidence if the approved COVID-19 protocols were followed up to ensure that the results were informing the national response to the pandemic. The third key finding was about issues of rapid review of COVID-19 protocols. We found out that the current SOPs that are being used by RECs in Malawi talk about expedited reviews of low-risk studies, and that any high-risk studies have to be reviewed at convened REC meetings. So currently, we do not have SOPs for fast-tracking high-risk studies. As such, some of the RECs in Malawi are actually asking researchers who want their protocols to be fast-tracked to be able to fund review meetings if their protocols were to be reviewed rapidly. The fourth and last key finding on experiences regarding REC operations during the COVID-19 pandemic was about the effects of conducting virtual meetings. It was reported that higher data costs and poor internet connectivity affected members' attendance at virtual meetings. They reported that sometimes they would start a meeting with a quorum, but then in the process they would lose members and finish without a quorum. Some participants also reported having challenges with virtual meetings. These specific members complained that they do not have laptops and they don't have Wi-Fi for internet connectivity in their homes. And so it was always difficult for them to attend these virtual meetings without, when they do not have laptops or even internet connectivity. Now I'm going to talk about the second category of key findings, which is about ethical issues that were raised during the review of research protocols. The first key finding on ethical issues raised during review of research protocols was about the debate on financial compensation for research participants. In Malawi, the debate around financial compensation for research participants is an ongoing issue, but REC members wanted the researchers to provide appropriate compensation during the pandemic. It was reported that other members of the REC felt it was appropriate to increase the financial compensation because the public transport costs had increased. Of course, others felt the researchers who had been conducting research before the COVID-19 pandemic would find it difficult to increase financial compensation for research participants, probably because they could not adjust their already approved budgets. The second key finding on ethical issues raised during the review of protocols during the COVID-19 pandemic was about inadequate safety information to conduct clinical trials involving herbal medicine. It was reported that during the pandemic, some researchers submitted applications to conduct clinical trials on herbal medicines that were believed to cure or treat COVID-19. However, the RECs observed that the herbal medicines were not tested in labs nor in animals, and none had been tested in phase 1 trials. In other words, results for preclinical studies on the herbs were not available at all. The researchers, of course, provided a justification that a herbalist had been using the herbs to treat patients, and observation data appeared to show it is effective in treating COVID-19. But then members of the REC felt it is unacceptable to conduct a clinical trial without in vitro testing, while other members felt Malawi doesn't have the capacity nor sufficient supplies and equipment in chemical laboratories to conduct in vitro studies on herbal medicines. So these applications to conduct clinical trials on herbal medicine were actually rejected by the RECs. The third and last key finding on ethical issues raised during reviews was about challenges in demarcating research from practice. it was reported that some applicants submitted protocols in which they were requesting exemption from ethical review, while others were seeking for a waiver of consent. These applicants had research proposals about the COVID-19, but then the RECs were very strict and they did not grant those requests. Mostly the proposed COVID-19 research studies were conducted in routine clinical settings and they appeared like programs. So it was difficult and problematic for the RECs to decide if the research studies needed exemption from ethical review or even a waiver of consent. Of course, in this study, we found out that the waiver of consent is very strict in the Malawian context, and it is not easy for an applicant to get a waiver of consent. Now I would like to talk about the recommendations that we have based on the findings of this study. The first recommendation is that we need a national guidance document for REC operations in Malawi. The national guidance document that should be developed by the regulatory authority should address the findings from this study. The second recommendation is that Malawian RECs need to have some coordination and that they need to pool their resources together and have something that is similar to the research ethics support in COVID-19 pandemic that is in South Africa. Thirdly, we would like to recommend inclusion of specific budget lines for emergencies in REC annual budgets. And finally, we would like to recommend that there should be a national compensation model for research participants that is similar to the tier model that is used in South Africa. In conclusion, in this presentation, I have highlighted challenges of REC operations and the challenges that are encountered by REC members during protocol reviews during the COVID-19 pandemic. Some of the challenges I've highlighted include inadequate REC guidance for REC operations, lack of SOPs for fast-tracking high-risk protocols, lack of funding for dealing with emergencies by RECs, especially during the COVID-19 pandemic, the effects of high data costs and poor internet connectivity for virtual meetings that are conducted by REC members, and the lack of capacity to conduct in vitro, in vivo, and phase 1 clinical trials on herbal medicines. Finally, Tiwonge and I would like to thank the WHO for funding this study in Malawi. We would also like to thank REC members and REC administrators who agreed to take part in this study. We would also like to thank you all for listening to this presentation attentively. May God bless you all.